In 1995, the Senate of Canada decided to ask a group of senators to study the issue of euthanasia and assisted suicide. That was the time when we were discussing cases like the Sue Rodriguez case, who wanted permission from the Supreme Court of Canada to have an assisted suicide. Well, the senators were like the Supreme Court of Canada. We didn't come to any unanimous conclusions about euthanasia and assisted suicide. But what we did come to were unanimous conclusions on the way Canadians were dying. We recognized that many, many Canadians were dying in intractable pain, and they didn't need to. Many, many Canadians were dying hooked up to machines they didn't want to be hooked up to. And so I have spent essentially the last 15 years of my life dedicated to promoting quality end-of-life care, better known as palliative care, from coast to coast to coast. Now, it's interesting because Canadians, like many others throughout the world, are essentially a death-denying society. We don't want to admit that people are going to die, but the reality is that 100% of us are going to die. And I think the question is, how do we want to do it? Do we want to die in intractable pain? I don't think so. Do we want to die with a sense of indignity of what's happening to our physical bodies? No. Do we want to die hooked up to machines that we have really decided we don't want to be hooked up to? And the answer is no. So the answer for Canadians is quality end-of-life care, quality palliative care. Now, we've experienced some really good things in Canada in the last 15 years. When we did an estimate, for example, in 1995, we estimated that perhaps 5% of Canadians had access to palliative care. Now we think that number may be as high as 37%. That may be a bit optimistic, but clearly a big improvement from 5%. Unfortunately, it still means that 63% of Canadians don't have access to quality end-of-life care. There are a number of reasons for that. Partly it's because we don't want the discussion. People are still reluctant to talk about death and dying. And yet, because it's inevitable for each and every one of us, we need to have those discussions. Our family has to know how we want to be treated at the end of our lives. We need to support programs throughout our country. And it is remarkable to me the thousands of volunteers that sit by the bedside of dying Canadians in every community across this country. One thing's very interesting. We seem to have a reduced number of volunteers for many, many activities. The hospice palliative care community, on the other hand, has an increased number of volunteers. So it's obviously work that people feel in the depth of their being as being not only responsible work, but extremely rewarding work. That's true when you talk to the doctors and the nurses and the occupational therapists and the social workers and the spiritual caregivers, all of whom are an essential part of the palliative care team. They too think that they are doing extremely rewarding and satisfying work. But we need to help this grow. And we need to get a federal government who recognizes that they have a responsibility here. Tragically, in Canada, we had a secretariat for end-of-life care in the Department of Health, but they have cut all of its funding and it no longer exists. We used to have volunteer groups of doctors, nurses, specialists in other medical fields, as well as volunteers and caregivers that were studying things like better public awareness, better public education, better best practices dissemination, the research capacity required. They've all been disbanded by this present government. And yet, we know that on average, about 250,000 Canadians die a year right now. Within 15 years, that's going to be 400,000 people a year. If we don't increase the kind of palliative care services available, the numbers of Canadians who will have access will actually reduce in numbers. So we won't be at 37%, we'll go backwards to perhaps 28%. If we want to deal with death and dying in an effective way, we have to have palliative care choices. The debate on euthanasia and assisted suicide isn't going to go away. There will always be some people who see that as their ultimate solution. For me, that debate is premature. That debate should not take place until such time as there is 100% access in this country to quality end-of-life care. When people know that they have a choice, and that choice does not mean taking their own life or having someone else assist them in taking their own life. That's why I've spent the past 15 years of my life working in hospice palliative care. That's why I will remain dedicated to the cause of hospice palliative care for the rest of my life. Because I'm a little bit selfish about this. I would like quality end-of-life care when I am no longer of a physical state that I can remain in this life. Then I want to know that the support system is going to be there for me, that it's there for my children, that it's there for everyone that I love and care about. And that means all care.